Hello, good afternoon or good morning for some, everybody. It is great that you could join us, especially in the middle, or I guess towards the end of August, when there are all sorts of summertime and back to school distractions in life. I'm Trooper Sanders, again, yes, CEO of Benefits Data Trust. And BDT has been around for nearly 20 years and really to serve two people. One are people who find themselves in circumstances of need where they need to tap our social safety net and the many benefits programs that can meet their essential needs, from healthcare, today's conversation, to food, to higher education and broadband, heating their homes, etc. As we all know, there's been a lot of work through our democratic process creating these programs, sustaining these programs. There's a tremendous amount of work and complexity that goes into administering these programs every day. But that can create complexities for people, average people who are trying to get through their days and make ends meet to navigate these programs. And it's really been an honor for BDT to support people by providing benefit screening and application assistance for individuals and families to the tune of more than $10 billion since we were founded. But also, we are here to support the public servants and others who get up every day trying to serve people who have needs and are trying to make ends meet and get ahead. Because we know that you face extraordinary challenges with the extraordinary part of public service, and everything that we can do, be it with wonderful collaboratives such as this, to our other technical assistance work and digital and non-digital tools. We know that you're committed to helping people, and you need allies who have your back to try to make your life and your jobs just a bit easier. And so it is an honor for us to be able to work with you. So these are really extraordinary times, coming out of a pandemic, navigating, the economic change that is going on. And, often programs such as Medicaid that we're talking about today are absolutely essential to both save lives and improve lives. And we've known for a number of years that as we were looking towards the end of the pandemic, that the day-to-day challenge of keeping people who are eligible for Medicaid on Medicaid is a challenge in and of itself. Then you add the unwinding to that only made that exponentially more challenging. And that's why several years ago, with the generous support of the Robert Wood Johnson Foundation, we established this Medicaid Churn Collaborative. And I want to thank not only Key, but extraordinary colleagues, Jamila and others who have been leading this work and going across the country and working with so many. And it really comes down to what are the everyday practical steps that can be put in place amidst all of the other extraordinary work that is going on to help alleviate this challenge, help ease access, improve access, so that we can get on with the work of improving the health of households and families and our communities. A lot of this is coming from the extraordinary experience and brain power across the country and extraordinary public servants who have been working on this. And I'm really excited that today we shine a light on one of our oldest states in the union, Rhode Island, to be able to hear all the great work that has been going on there and learnings, and to be able to continue this national conversation. This work that we are doing around Medicaid is important in its own right. And for those of us who've been involved in health insurance coverage or public health, or for me, like a gazillion years ago when I was much younger, working on the early stages of fighting mental health stigma and parity. But I think, even for those of us who care about healthcare, it's important to remember that literally everything we are doing to improve benefits access touches almost every priority that our country is facing. Top of mind for me, frankly, has been around the environment and climate change and disaster. I mean, this has been an extraordinary summer and time for weather-related issues. And at first glance, you might say, well, all right, what does Medicaid and health insurance coverage have to do with climate change? Well, as we all know, or many of us know, that as weather-related incidents increase, as climate change bites, that is going to exacerbate underlying health conditions, health disparities, and other issues. And so that makes ensuring that we have ready, easy, scalable access to Medicaid and other access to healthcare an essential part of our climate change response and addressing the inequities that are going to come from that. And I could go across almost every single thing that our country is facing and connect it right back to the work that we are doing here of doing what we can to ensure that people who are eligible for Medicaid can stay on it and get the care that they need. And so I know that so many people here see themselves as warriors in the healthcare fight and health and wellness fight. But I would just say that you are warriors and successful warriors in literally everything this country is dealing with. So I cannot thank you enough. I'm really pleased that my colleagues and me are able at BDT to be on your side, and we look forward to the work ahead. Key?
Thank you, Trooper. So as Trooper said, I'm Key Powell, and I am the Senior Policy Director here at Benefits Data Trust. I recently came from the Colorado Department of Human Services at the state level, where I was the Office of Economic Security Director, overseeing anti-poverty programs, including SNAP, TANF, LEAP, child support, etc. And I moved to BDT to be able to highlight state and local administrative voices that are working so hard on the ground to serve their communities every day. And having implemented large-scale change at a state level, I am humbled by the daunting challenge of managing Medicaid unwinding, given that states have non-nimble infrastructures, resource capacity constraints, as well as critical staffing shortages. I also know that the reason we choose Human Services Administration work is because we deeply care about serving our communities, and in this case, ensuring that every eligible person has healthcare coverage. I want to commend our state and local administrators for their tireless efforts to serve those in need. BDT is honored to lead this Medicaid Churn Learning Collaborative as part of the funding from Robert Wood Johnson Foundation. Our intention was to take what we learned from the 6 states that we partnered with and be able to turn that back out to other states, as well as to advocate for policy and practice changes at the federal level. I'm going to turn it over to Jamila McQueen, our Senior Healthcare Policy Manager who specializes in Medicaid, as well as Anthony Salvo, who is the Chief of Family Health Systems at the Rhode Island Executive Office of Health and Human Services. I will be back to facilitate the Q&A portion at the end of this webinar, but with that, I will kick it over to Jamila and Anthony. Thank you.
Thanks, Key. Next slide, please. And thank you all for joining us for today's webinar. Because we have a pretty diverse audience here, I'm just going to take a few minutes to set the stage and provide some high-level context about the Medicaid unwinding before turning things over to Anthony, who will share the Rhode Island perspective. As you all may be aware, at the beginning of this unwinding period, Medicaid enrollment was at an all-time high. In April of this year, there were over 94 million people enrolled in the Medicaid program, which represents about a 32% increase over the last 3 years. But how did we get here? Next slide, please. As I'm sure we all remember very vividly, because 2020 was yesterday, in the early 2020, COVID-19 was declared a public health emergency, and as cases grew, we were all sent home for 2 weeks. And in an effort to protect access to care during this health crisis, the federal government passed the Families First Coronavirus Response Act, which prevented states from terminating coverage for most Medicaid enrollees for the duration of the public health emergency. And as you all know, 2 weeks turned into 2 months, which turned into 2 years, which is what contributed to the significant growth in the Medicaid program and the enrollment numbers that we see today. And then finally, we saw the passage of the Consolidated Appropriations Act of 2023, which decoupled the continuous coverage requirement from the public health emergency and instructed states to resume Medicaid recertifications and return to normal operations beginning April 1st. A daunting task, of course, because as you've seen, the size of the Medicaid program was at its largest. Secondly, this is a new and unfamiliar process for all enrollees. And similarly, it's also a new and unfamiliar process for state Medicaid staff who just have not done this before, are doing it for the first time, or haven't done it in 3 years. Next slide, please. So in response to this sort of unprecedented space that we were operating in and the resumption of Medicaid churn, we developed the Medicaid Churn Learning Collaborative to support states during this unwinding period and beyond. And we are so honored that we have had the opportunity to work with California, Kentucky, North Dakota, Rhode Island, South Carolina, and Washington over the past year as they have developed, modified, and are now implementing their unwinding plans. Next slide, please. Through the Medicaid Churn Learning Collaborative, the states that are participating have received support through tailored technical assistance with the BDT staff, as well as national subject matter experts, resources and technical assistance tools like our Medicaid Churn Toolkit, site visits, and I think most importantly, access to peers. All states are working on the unwinding, and there is no need to recreate the wheel. And through peer interactions, we have seen the states in our learning collaborative share everything from examples of outreach materials to best practices to streamline the ex parte process for non-MAGI enrollees. And we have been truly excited and impressed by the way in which our states have put so much effort and thought into how they're approaching the unwinding process and thinking about how to address churn strategically, both now during this unwinding period and beyond. So with that, that's where we are today. I'm so excited to turn things over to Anthony Salvo, who supports the Medicaid Systems team as Chief of Family Systems for the Rhode Island Bridges system with expertise in Medicaid eligibility. Anthony truly has been in the trenches of the Medicaid return to normal operations for well over a year. As state lead for Medicaid renewals and termination quality, he has been the catalyst for ensuring a high level of renewals quality over a 3-year hiatus from processing renewals due to the COVID-19 public health emergency. Outside of work, he enjoys spending time with his wife and 3-year-old son, trying new restaurants, and rewatching The West Wing over and over again. Anthony, thank you for taking time out to join us today.
Thank you, Jamila. And I wanted to first thank BDT for inviting Rhode Island to present today and to kind of showcase some of the things that we've done up to this point throughout the PHE and now into the unwinding period. I also wanted to give a special shout out thanks to the entire Rhode Island Medicaid team. Everything that you're going to see today and hear about today wasn't done by one person or one individual. It's been a collaborative effort between our Medicaid systems team, our communications team, our operations team, our policy team, our data team. We, as you said, we are in the trenches every single day, doing our best to try to keep people who are eligible for Medicaid enrolled in the coverage. And as you'll see today, we've got a few things we've tried and we've found that they've worked. So we'll just get right on into it. If you go to the next slide, I'll give you a little overview of Medicaid renewals in Rhode Island. So at the onset of the unwinding period, Rhode Island elected to start renewals in April of 2023 for our approximately 350,000 plus members. Starting in April gave us more time to prepare, to do some more communications and outreach, and just get our population ready for renewals to begin again. They had been paused for, as you stated earlier, 3 years. As of August, we've gone through so far about 5 cohorts, what we call cohorts of renewals, are just individual groupings of renewals. There's been 5 so far, approximately 70,000 individuals. As of right now, we're seeing about a 65% passive renewal rate on average. And what has come to light recently, I think, from some of our CMS colleagues is that the attention on the household versus individual level ex parte passive renewal process. So Rhode Island, we do our ex parte renewals at an individual level. Our return mail rate thus far has been approximately 2%. And not only has this been a collaboration internally with EOHHS and the Medicaid team, but the way that Rhode Island is designed, we work hand in hand with our sister agencies, which are the Department of Human Services. So they're the staff that answer the phones, that actually work the renewals, see our clients face to face, and Health Source Rhode Island, which is our state-based exchange where members can purchase qualified health plans. One other piece I'd like to add about the way Rhode Island does renewals, because I think it helps to kind of understand the overall picture, is that our renewal cycle is a 60-day process. So when we said we started in April, the first renewal packet started landing in members' mailboxes on around April 1, with our first set of terminations effective May 31st. We go to the next slide. So kind of the topics I'm going to touch on today are 3 strategies that Rhode Island has done during the unwinding period. The first is an uptake of unwinding flexibilities, consumer outreach and engagement, and diversifying customer service options.
Thanks, Anthony. One quick question as we get into the presentation. On the prior slide, you mentioned that you all had a 2% return rate. That is exceptional considering that it's been 3 years, people have moved. How have you accomplished this? Can you speak more to how you guys got to that 2% rate?
Sure. So there's a few things to that. So one of the pieces, and I'll get into this when I touch on the uptake of unwinding flexibilities, is that during the unwinding period, CMS offered temporary, what they call 1902 E14A waivers. So these are flexibilities that states can take up that they couldn't normally take up. And one of those waivers that we got was to utilize the National Change of Address database information directly without having to first confirm that information with our members. So what we did as part of that was we took change of address information from the National Change of Address system and directly updated that into our eligibility system. Therefore, not taking the extra step of having to verify that with the member. If you updated your address with the NCOA, that's a pretty secure source. So by doing that prior to the onset of the unwinding period, we did a ton of outreach, both on the media side and both on the direct to members side. So right prior to the unwinding, we sent out a mass email and mass notice to members, letting them know that, hey, Medicaid renewals are going to start again. Here's the best thing that you can do. Update your contact information, number 1. And we continue to push that information throughout the unwinding and will continue to push that information because we know that contact information, addresses are constantly changing. And the third piece of that, and I'll touch on this when I get to some of the consumer outreach pieces, are in Rhode Island, we send text messages to members when we actually get returned mail. So we've been sending out mail for our other human service programs throughout the PHE, even if they weren't Medicaid renewals. So when we did get returned mail for those individuals, we would send them a text letting them know we got returned mail. Here's how you can update your contact information. We can go on to the next slide. And I think one more too. Yep, perfect. So uptake of unwinding flexibility. So as I mentioned about the last bullet there, the National Change of Address waiver that we got, that one was, we've had that in place for quite a while. The other piece, the other waiver that we asked for and received from CMS was the waiving the asset test for non-Magi beneficiaries at renewal, and also extending that to changes in circumstances post that renewal. And that just makes sense from a system perspective, right? If you're going to ignore the assets at renewal, if that member, if eligibility runs on that case or that individual again 2 months later, you still want to ignore the assets. The whole point was, right, to waive them throughout the unwinding period. The other waiver that we asked for and received was permitting MCOs to assist members in completing their renewals. And finally, it was extending the time frame to take final administrative action on fair hearing requests. Going back to our kind of overall renewal process, one of the things that we decided to do as a state was start slow. We knew we hadn't, I like to use the analogy, like we hadn't turned the lights on in a while in the room. So we knew there were going to be some bugs, right? You turn the lights on, you haven't been in this room in 3 years. So we started slow. So our first couple of cohort populations, we limited those for that very purpose. And as we go along, that population will increase and diversify. The second thing that we did was, with the signing of the Consolidated Appropriations Act by the President in December of 2022, all states were required to provide continuous coverage to children for 12 months. Rhode Island was one of the, I believe, dozen or so states that had not already had that in place. So with that new policy piece in place, we made the decision to go ahead and give our children and families additional time during the unwinding period. So all of those renewal dates will occur in 2024 when the continuous coverage requirement is in effect. And as I had mentioned earlier, one of the things that we had done at the onset was send out this mass notification to everyone, letting them know that renewals were restarting. What we also do too is send out reminder notices to members, letting them know if they haven't responded to their renewal, and again, sending them an additional communication, both via text and notice, when they have responded. So all to alleviate, could potentially be unnecessary calls to say, oh, did you get my renewal notice? What's the status of it, et cetera. So we put those pieces in place.
Thanks, Anthony. I want to build off of something you said. You mentioned you turned on the lights, and there were a lot of bugs and pieces to that. But I also, building off of that, I know that while turning on the lights of the Medicaid program, you guys were also turning on the lights to these flexibilities, which allow the program to operate differently than it typically would. Would you share which one of these flexibilities, or which flexibilities had the biggest impact on the program and during the unwinding?
Sure. So I think the NCOA one was big, right? Because it allowed us to use that data. But I think the largest impact we've seen so far is the waiving of the asset test for non-Magi individuals. So as most states will probably agree with me on, ex parte renewals for non-Magi beneficiaries are challenging, right? Because the rules are different than Magi. We're not just looking at income. There's resources, there's federal rules and methodologies for accounting those resources that make any type of system automation difficult. So with this waiver in place, it's sort of like a sigh of relief for us, really, so that what we can do is, while we know we have the waiver in place now, it is temporary, right? It will go away at the end of the unwinding period, and we will have to return to normal operations. We now have the time and the breathing room to really look at that process of ex parte renewals for non-Magis and see how we can optimize it as much as we can, right? Finding any additional bugs while not negatively impacting members in the meantime. So I think that one was great. As soon as we saw that one come through from CMS, it kind of, our eyes lit up. So that was a really good one. We can go to the next slide. So consumer outreach and engagement efforts. These are things that we've done both with our communications team and with our systems team and with our managed care organization team as well. So continuous touch points with MCOs, advocates, and community partners. So with that, we have monthly forums with our MCOs, our community advocates, and partners to give them updates on renewal processes. And we will continue to utilize that throughout the unwinding period as we get closer and closer to December, which is when our first renewals for our families and our families with kids will begin. Additionally, we have bi-weekly sessions with a small group of community partners where we test out messages, preview upcoming resources, and get their feedback before we go ahead and make that live. An additional thing we do is we have what are called mini grants. These are focused on raising awareness or removing barriers and raising awareness for challenges that groups might have in completing the renewal process. And with these mini grants, we're focused on 4 areas. It's technology, training, outreach, and language and cultural competency development. Apologize. And each of those has kind of their own niches and nuances to it. So for the technology piece, right, this could include acquiring iPads or similar devices to help enrollees renew coverage, and also conduct public-facing coaching on using our mobile application, which I'll get to in another section. Training. So these mini grants can be used to help staff complete what's called self-paced certified SHIP counselor training. And those individuals could go ahead and help members go ahead and choose a new health plan, or if they're no longer eligible for Medicaid, what are their options post that? Outreach was the other one. So this is really about kind of marketing materials and reaching people everywhere, right? So in their homes, their businesses, their neighborhoods, festivals, events, community events. And the last piece was language and cultural competency development. So this is really focusing on developing language that simplifies what we all know to be a complex and complicated health coverage system. And its ultimate goal is to aid enrollees in gaining a long-term understanding of accessing coverage. So we're really proud of those mini grants. We had our first round go out in May of this year, with the next round going out in September for awards. And that'll be a quarterly process going forward. The other piece here is implementing a proactive text messaging strategy. So I want to say it was January of this year, the FCC provided guidance in response to a request from the CMS administrator and the HHS secretary, asking if states were permitted to text enrollees about their healthcare coverage. So we were eagerly awaiting that guidance from the FCC. It took quite a while to get it. But when we did get it, it was good news, because the FCC did grant us permission to go ahead and text enrollees about their Medicaid coverage. So in Rhode Island, what we do is we have automated processes in place that text members, as I mentioned before, when we get return mail, when an individual is up for renewal and they haven't responded, we send 2 of those messages out. And when we do receive information back from the member, when we receive the renewal notice back, we text them and let them know we've got it, we're working on it, be on the lookout for more communications from us. And the last piece here in this section is maximizing MCO engagement. So in Rhode Island, we currently have 3 MCOs. And what we've been doing with them is they were always eager and willing to help to keep their members enrolled. So what we do with them is we have this process where we send them a file after we run our ex parte renewal processes. We send them a file of their members who were active renewals, with the goal being for them to outreach to those members and help them complete the renewal process. 30 days later, we send them another file of members who have still not responded to us and are at risk of losing coverage. Both of those files are automated from our side, and those go out to assist our members. And we can go to the next slide.
Anthony, one question for you before we dive into
Yes.
the customer service options. Because you talked about the text messaging that you all are doing to your members. And I recall very clearly, as you mentioned, that was a strategy that states were hoping and waiting to get sort of guidance on. And it was something that you all implemented during the unwinding. Can you share a little bit more about sort of the language and how you all developed the language there, and how you all have been able to successfully automate that process?
Sure, yeah. So the text messages go out to anyone who's on Medicaid and has a cell phone number on file in our system. And we've been promoting people to update their contact information as well, so that they could receive these text messages in the future. One of the examples, and I brought a list here with me because I had an idea that we'd be talking about text message language. One of the texts that goes out is for return mail. And the message says, "We've sent you mail that has been returned to us as undeliverable. Please update your mailing address under my profile on healthyroad.ri.gov or call," and there's the number for the place, "so you don't miss important notices about your benefits. Reply stop to unsubscribe." So not only do we tell them that we got return mail, but we made a point to give easy, concise, clear directions of, well, how do I update my contact information? I go to my profile on my healthyroad.ri.gov website. So those have been in place for quite a while for the return mail. All right, so diversifying customer service options and member education. I'll start with our self-service scan center. So the scan center was opened in January of this year, and the goal being it's a quick service for individuals who can walk in and need scanning services. This could include renewals, new applications, requests for additional documentation. And what we found was that the need arose out of individuals showing up to our regional field offices, which were not self-service scanning centers by themselves. They did other things. They did allow for self-service scanning, but the volume was higher at those offices. And a good portion of individuals who were going to those offices were just looking to scan documents. So this gives them a place to do so and to ask some basic follow-up questions. At the same time, reducing the traffic, and some of them are more like full service regional offices. On average, we get about 300 of those customers a day in those offices, and the average wait time right now is between 3 to 5 minutes. So those have been very successful. The other piece of diversifying options is our Healthy Rhode mobile application. This mobile application was actually launched during the PHE in 2020. And this app, what it allows you to do is, while you can't yet today complete a renewal itself via the app, you can upload documents, view notices, check your application status, create an account. And what we've done throughout the PHE and now into the Unwinding as well is work on updating that app so that more and more functionality is there. Anyone who works in the Medicaid field knows that you can't do everything at once. So we've been trying to, as best as possible, focus on updating the app with things that will really help our members and hopefully reduce traffic and make it easier in our call centers and our field offices, and make it easier for members who wish to do self-service to do so. As of right now, we have approximately 21,000 active members on the application, and we look to continue to add functionality to that. Online and shareable resources. So fairly recently, we developed, at the onset of the PHE Unwinding, was the staycovered.ri.gov website. And there is our one-stop shop for all Medicaid renewal and health coverage questions. You can access education materials in 12 languages in a variety of formats with audio, visual, print, social media. We have sample notices. So if anyone's anticipating their renewal and says, well, what notice should I be on the lookout for? They can go and access those notices on that site there. There's information from community partners. There's recordings of our advocate forums, downloadable educational materials, information about the mini grants that I mentioned earlier. There's a data dashboard where anyone can go and access data on how many renewals we initiated, who was procedurally terminated, who was successfully renewed, who transitioned over to a qualified health plan. And our most recent tool on this website is our online Medicaid renewal date lookup portal. So what this portal allows members to do is, with what we call their Medicaid ID and their date of birth, they can access this portal with those two pieces of information and see when their renewal date is, both if it's upcoming in the unwinding period or if they've been successfully renewed 12 months into the future. So for anyone now, it would be in 2024. So we're really proud of that tool. It's hot off the press, relatively speaking. And we hope that members use that, especially as we get closer and closer to our renewals for our families with children. The other piece that I neglected to mention here is that our sample notices for renewal notices, our benefit decision notices, any other notices that we're sending out. One thing that Rhode Island did do for our renewal notices is we printed them on yellow paper just to make them stand out that much more to members. And we pushed that message too in our marketing and communications, was be on the lookout for your yellow notice to draw attention to that. And this is just some information about the self-service scanning center. As you can see over time, the volume has kind of gone up. Go to the next slide. And these are just some pieces from our Healthy Rhode mobile application. You can see on the right some of the interface screens, what that looks like, etc. Easy to use, easy icons, simple icons, which is what I really like. Keep it simple. And here's just from screenshots from our staycovered.ri.gov website and some of the member materials that are out there already. This website is public. Anyone can go see it, see any of the materials that we've talked about today. Thank you.
Thank you, Anthony, and thank you so much for sharing and providing such robust, detailed information about the work that you all have been doing over a pretty short period of time. You all have made significant changes in self-service options, the policies that you all have adopted. I know that we joke about this. Sometimes you don't know how hard it is to actually order yellow paper until you realize that there are supply shortages. So I want to recognize the amount of work that goes into and has gone into being as comprehensive as possible in this unwinding period. And I know that I've seen the questions coming in, so I'm going to kick it back to you, Kei, because I know we have a number of them.
Yes, thank you so much. Just want to reiterate, thank you so much, Anthony. That was a great presentation, incredibly robust in terms of the number of efforts that you're putting in to address Medicaid unwinding. I want to remind everybody that if you do have a question, please feel free to put it in the Q&A portion of on the bottom of your screen, and I will be going through those and posing them both to Anthony and Jamila. So please don't think that you can only ask Anthony questions. Jamila is here too. I'm going to kick it off with one that was sent actually beforehand, Anthony. And this question is, what are the biggest technical challenges you are facing?
Yeah, so one of the challenges that we face, and I'm going to go on a limb here and say a lot of other states are struggling with as well, is that as we've kind of navigated the waters of the end of the PHE into the unwinding period, we're learning things that we want to modify, that we want to change, we want to enhance. What made sense in 2019 may not make sense in 2023, 2024 anymore. All great things, identifying new system enhancements like a mobile application. Problem with that from a technical perspective is that, unfortunately, we don't have a magic wand where we can make a spell or snap our fingers and get that done right away. In Rhode Island, we kind of line up our system enhancements on what we call a runway. And we have quarterly releases where we do deploy new system enhancements. The work that goes into those enhancements takes months. Right now, we're working on system enhancements, designing and developing those enhancements that will go in place in March of 2024. So that gives you an idea of some of the technical challenges we face. It's that we may have come up with a great solution. We can't get that in our system for another 7 to 8, 9, 10 months. So it's really kind of trying to implement temporary strategies to achieve that as best we possibly can while keeping our eye on the long-term solution. The other piece too, and I think it's a technical challenge, but it's also not. It's, we talked about statecover.ri.gov. We talked about the Healthy Road mobile app, which are all great high-tech solutions. But one thing that we know we cannot forget is the low-tech solutions. Good portion of our population will never download the Healthy Road mobile application as much as we promote it and market it, or will never visit statecover.ri.gov. They look for mail, right? They check their mailbox. That's how they hear from their state Medicaid agency, which is why we focused on changing the color of the paper. One other piece that I neglected to mention earlier was that for our renewal notices and for our benefit decision notices, we actually, on the outside of the envelope, stamp a message, important information, please read, on our renewal notices. And for our benefit decision notice, I forgot the exact language, but it's something along the lines of please open immediately, or important options about your healthcare, or something along those lines. So we're trying to keep in mind those low-tech solutions while also, keeping up with the times and going forward with the mobile application.
Yeah, thank you for that answer. I think, in my opening remarks, I mentioned, non-nimble infrastructures, and that was exactly my experience. It's like you're planning 12 to 18 months in advance to change anything in your data system. And so it's really hard to pivot, on a dime. And so there's a lot of strategy, right, involved in like when you can pull the trigger on some of these policies, because often the way policies get enacted is through your data system as well. So it is a strategy game that you're playing. I'm going to turn this next question over to Jamila. We've actually gotten a couple of questions on the national change of address option or waiver, that we spoke about earlier. So there's a couple of things that I'm just going to lump them together. One is, does that waiver still exist? Could other states, if they were interested in pulling on that lever, if you will, still ask for that permission through CMS? And then the other portion of that was, were all states informed about the NCOA opportunity?
Thanks, E. And yes, that waiver still exists, and there are a number of flexibilities. The technical term that we keep saying are the E14 flexibilities. So these were made available to all states and are available to all states during this unwinding period. So states that have not elected to adopt it up until this point, they still have the opportunity to do so. I think Anthony can probably speak to this, that there may be some technical pieces around how a state is able to ingest the data from the National Change of Address database and whether it will affect their eligibility systems. And if you operate an integrated eligibility system, it can affect other programs like SNAP or their food assistance programs. So states do also have to weigh the impact of that as well.
I agree. You're going to have to get to know your state mail room, which we did here in Rhode Island. We took a field trip one day. Very informative.
Sorry. Yep. I was going to say, you're not only your mail, but your printers, right?
Yes.
That's a big darn deal. Anthony, this is a question I'm just curious about because I've been following the Rhode Island storyline since as a part of the Medicaid Churn Learning Collaborative. One thing you didn't mention, but I'm pretty sure it happened in Rhode Island. Can you talk about the QR codes that you added to your mail? Because I don't think you mentioned that here today.
Yes.
And I thought that was a really innovative strategy.
Yeah. So when we send out a notice, it has a QR code on it and on the outside of the envelope as well. So when we get that piece of return mail back, by accessing the QR code, by reading the QR code, our system can tell you this is document number 12345. It is a Medicaid renewal notice, and we get a digital image of that exact notice. So we can tell if, did this person, was the return mail received for their renewal notice? Was it for a benefit decision notice? Was it for a non-Medicaid notice? We know exactly what notice came back. So that piece, that was a enhancement we did a couple of months ago, I want to say.
Yeah, and I can just imagine what a big darn deal that is, given the volume of mail.
Yes.
And also the staffing shortages that many states are experiencing as well. So did you see that? Was there like time savings from using that strategy?
I don't know if I can speak to time savings, only because I'm not as on the ground on that with other things that I'm involved with. But there's definitely been efficiencies, and just from a data perspective, letting us know that, okay, we had this renewal cohort of 10,000 people. We got, 1.5% of renewal notices returned back. In the past, we could say, well, we got 3% return mail in X amount of days. Now we can narrow it down to, if you're looking at renewal notices, this is how many we got back.
And Key, I want to speak to the efficiency of that, because it sounds like such a small change, but I know that there are many states that don't have that option available. So there are staff that are dedicated to opening every single letter that is returned and scanning it back into the system. So we can imagine the amount of time that it takes to do that, as well as the amount of paper cuts that are probably associated with that. So if we also want to look at it from a health perspective and a time-saving perspective, I think it's a great way to highlight such an efficient way to automate a process where staff time can be directed to serving those that need more support.
100%. Anthony, I have two questions that are more maybe definitional or level setting.
Sure.
One is, can you describe what you mean by passive renewal? And the other is distinguishing between that approach. You said Rhode Island chose to do the individual level, not the household level. And what does that mean for like somebody who hasn't lived in the Medicaid world? Like, what does that strategy actually mean?
Sure. So when I say passive renewal, that means the same thing as an ex parte renewal. So the member there's no action for the member to take. We've been able to successfully renew them with the information we have on file and that we were able to verify with external sources. When we talk about the individual versus household level renewal status, what that means, and we've always done it at an individual way, and admittedly, I didn't know it was possible to do it any other way, but apparently it is. What that means is each individual in the household is determined individually. So a good example that I can always think of is, and we haven't had this happen yet, only because we have not renewed children and families yet, but you have a household with a mom and 2 children, okay? They're up for renewal. The FPL for mom is one level, and the FPL for the children in Rhode Island is much higher. When we go to do the renewal for this household, there's a chance that mom could not be a passive or ex parte renewal, and the children could. So our system supports that. We do that. Mom would become an active renewal, required to take action based upon whatever data led her to maybe fall out of the passive process, and the 2 children would be passively renewed. If mom fails to take action or fails to respond and is procedurally terminated, her 2 children would remain covered because they were passively renewed.
That was a great explanation, and thank you for that. Sometimes we get so wonky and in the weeds of the things that we know, but they are not known to everybody else.
Yeah.
So I'm going to move us to another question. So what additional strategies has Rhode Island employed for people who miss the mail or are non-English speaking, or maybe don't have a phone on file?
Yeah, so one of the things we've also been doing with our MCOs is, as I mentioned, we give them a list of the individuals who are active renewals, who must take action, who haven't responded. And as part of this MCO assister waiver, we're going to be sending them people who are procedurally terminated. So they may be able to do outreach themselves for that. For the people who may not have a cell phone number on file, we didn't forget about the paper mail. So those renewal reminder text messages that we have going out, the same is mirrored in a paper notice, letting the member know that, hey, we haven't heard from you about your renewal. That goes out approximately 25 days or so after we've sent that renewal notice out for you. What we're also hoping as part of some of the mini grants and some of the community outreach is that we're reaching members where they are, right? So kind of blanketing this message of, hey, renewals are restarting, be on the lookout for your yellow renewal notice across all these different advocates and organizations, even if we have someone who maybe is involved with their local senior center and sees the flyer on the wall, or is at a farmer's market and sees a flyer or a brochure or something at that location. That was our goal with that, to try to reach members everywhere while also getting that direct connection when we can for those with the text messages and the emails on file, or cell phone numbers and email addresses on file.
Thanks. So one, I want to acknowledge that we said this webinar would go to 12:50. I just also want to acknowledge there are a number of questions in the chat. And I think Anthony had told me beforehand it was okay to go about 5 minutes over. So if people want to stay, we will go through, I think, just a couple more questions given the demand that we're getting. But also appreciate that if people have to drop off, given that this is when we said we would end, we understand that. So Anthony, I told you I thought we were going to get this question, and we just got it. So how is Rhode Island thinking about having to reintroduce that asset test post PHE?
Yeah, we're having nightmares. No, I'm just kidding. So one of the things I think we're going to be doing is when we get closer towards the end of the unwinding period and we start going back into our normal operations, is kind of spreading the message, doing some initial communications and outreach that this is going to be restarting again, checking for renewals. So the best thing you can do at that point in time is, again, be on the lookout for your renewal notice. Make sure you respond to any communications that you receive from the state. But one of the things that we're also hoping to do is to really improve and optimize our AVS system, our asset verification system, which is a vital part of our non-Magi passive renewal process. So the hope being that once we can kind of fix that up, and now we have the time to do so, our passive renewal rate hopefully won't take much of a hit once we do come out of the temporary waiver for the asset test.
I feel like we could do another webinar in a year and be like, and how did it go? So more to come from Rhode Island on that one.
We'll see more gray. That's about it. Here.
Perhaps.
Yeah.
So there's a question in the chat, and actually you didn't say this, and I don't know the answer. On the confirmation notices when renewals are received and processed, is that also automated like the QR code? So like, do you just get the QR code, like clearly they sent it back in and we just automate that text, or does somebody have to touch that?
Nope, that's all automated. So what happens is when we get a renewal notice scanned into our system populates what we call the packet received date. And there's a batch process that runs that looks to see every day, okay, who has sent in their packet. It looks for that packet received date field completed, and then a batch automatically generates the notice, the text message, and sends it out. Completely hands-free. Not only is, I forgot to mention this as well, we do send it out via paper. We do send out the text. If you use what we call our customer portal or self-service portal, on your dashboard there, it also has when we sent you the renewal notice and when you sent it back. So you can see there that, okay, it has been received. That information is also available on the mobile application as well. So we kind of, again, spray that message everywhere. We got it. We're working on it. Be on the lookout for your benefit decision notice.
Yeah, I mean, I think that's really strategic in that sharing as much information as you can with clients hopefully drives call volume down. And having those other mechanisms so that they don't have to make a phone call, have to have a wait time, or we have like too many calls that we can't keep up with is a excellent strategy. This is the last one given time, and I just wanted to there was one in here that is asking about, is Rhode Island using any express mail as a part of their strategies here?
Not to my knowledge. I can definitely follow up on that, but I don't believe we are.
Okay. Well, there are other questions, but again, I want to be really mindful of time. I'm going to ask for the last slide to just come up, so that way, if your question was not answered today, and you would like to have that question answered, or you have further information that you'd like to discuss, there is my email address again, Powell, kpowell@bdtrust.org. I also am excited to, we mentioned this, I think, at the outset, but this is actually a series because we had 6 states that participated in our Medicaid Churn Learning Collaborative, and 3 of those states are going to be presenting. So the next one you will see, we're spacing them out because we know how busy all of you are. The next one you will see is on Thursday, September 21st, and we will be, we'll have California here with us to share some of their excellent work. And excited to have them come and present. So I want to take this opportunity again to thank Anthony for his time today. We know how busy he is, and thank you to Rhode Island team who have worked so hard and also hard in preparing the materials today. I also want to thank Jamila, who has been the leader of our Medicaid Churn Learning Collaborative, but also was a great facilitator as well today. And finally, I want to reiterate and thank again the Robert Wood Johnson Foundation for their support of this effort. We could not have done this without them. The other thing that I just wanted to mention is that we will be sending out a brief survey following the webinar so that you can tell us other things that you might have missed or that you want to hear about, but also give us feedback about ways that we can do this better. We will also share a recording with you and with you all that attended in a few days. The last thing is there was a question about whether or not we would share the slide deck, and it is our intention to be able to share that out. And I don't know where we've decided to do that, if it's going to be on our website or just in an email, but we will figure that out and be sure to communicate that. So again, thank you so much for all of you who joined us today. Really appreciate your time, and I think we will end it there.